Welcome to the Depth Perception Podcast.
We go in depth about the perceptions and misconceptions of optometry,
which includes the business of optometry,
social issues within optometry,
and life as an optometry student.
Coming straight from Dr. Jasdeep Singh Soni,
Dr. Nadia Afghami,
Dr. Douglas Akiti,
and Svetlana Nunez. We hope you enjoy this episode. Hi, everyone.
After listening to the episode, if you want to try Barti at your practice, we have a 20% discount on your first year contract with Barti from the Depth Perception Podcast.
Click the link in the show notes to set up your appointment with Barti and learn more. Enjoy the episode. Listen, if we're talking about tech things, I think that's your avenue there, Colton.
Yeah. That's the issue, though, is it's everyone's favorite joke to make if I can't figure out anything technology. They're like, oh, you're a tech CEO. You can't figure out Netflix, or like you can't get the TV to work, you know?
Yeah.
Like you can't get Zoom to work. It's like, okay, guys.
That's the joke that I would have made if I was your friend.
People love family. Everyone loves to make that joke. If I struggle at all, they're like, oh, really, Mr. Tech? Like, I'm like, okay.
Mr. Tech.
That's hilarious.
I'm like, I'm more on the business side, so I'm not the technical guy.
Hey guys, in this episode we have Barti with us, and if you don't know, Barti is a EHR company, and we're going to learn so much more about it. Today we are going to be swiping right on the perfect EHR. So in this episode we have the CEO of Barti with us, Colton Calandrella. Did I do that right?
Calandrella.
If you can't tell, he's Italian. And he's joining us on the pod to navigate the world of EHR systems using the funny, familiar context of modern dating. So we're going to be dating EHRs today. So we're going to have a fun, informative discussion that we're going to be exploring everything about EHRs from initial selection to long-term commitment with an EHR. And we're just going to be discussing when you should swipe right on that EHR. So, Colton, do you want to introduce yourself? Tell us a little bit about you and Barti.
Yeah, thanks so much for having me. Really excited to be here. My name is Colton Calandrella. I'm the CEO and co-founder of Barti Software. We are a new EHR and practice management software specifically for optometry and powered by AI. I'll just give a quick background on myself. Like I mentioned, I'm the CEO. We started the company about 2.5 years ago, along with the help of over 30 ODs who helped us design and build a new EHR from scratch. Before that, I was working most immediately in healthcare technology at the management consulting firm Bain & Company. And then previously have built a number of other software companies and products, including a variety of different industries, and born and raised in Colorado and now based in San Francisco, where the company is headquartered.
Nice. Well, let's get right into it. Like swiping left, swiping right. When is it the best time to swipe right on the EHR service of your dreams?
Yeah. I think the reason this is such a fun and important topic, and I think the reason this analogy works between EHR and dating, is your EHR, if you're a practice owner in optometry, really is like your partner. It's like one of your biggest decisions you need to make, because that software is really the lifeblood of your business. It's really mission critical. You spend way more time with your EHR than you do with your kids, than with your spouse, because you're in it all day, like every day. And not only you, right, but all of your staff is using it all day, every day. It's the system of record. It's really the lifeblood of the whole business. So, and in the analogy of dating, it's not one that you want to do just like, oh, quick hookup or whatever. Like you really want to try and find your partner for the long term. I was just talking to a practice owner who'd been with their EHR for 30 years, which is definitely the exception. But that's longer than a lot of marriages. So,
Right.
I think this analogy is important. When it comes to swiping right, what are you looking for? Well, at the risk of mixing metaphors, I don't know if any of y'all drink wine, but I remember one time I was at a vineyard, and the main person giving the tour said, "Do you know how a wine is a good wine when you taste it? It's if you like it. If you like the wine, it's a good wine. It doesn't need to be any more complicated. It doesn't need to be any more complicated than that, right? So it's very subjective, and it's like, If you like it, that's a good wine, right? And nobody can tell you otherwise. Nobody should tell you that's not a good wine. If you like it, it's a good wine. So the first thing is do you like the look and feel of the EHR when you're in it, when you're clicking around? Does it feel like something that you feel happy with all day, every day? Because again, you're staring at that screen, as you all know, hours and hours a day. So that's the first thing, is it's just subjectively, do you feel like it fits you and it's something that you're happy with? I think there's a couple other key things you want to look for, and there's a long checklist, but I'll just talk about a few things. And one of those is cloud-based, which is probably a given for a lot of folks. But what that really means is that you're able to access it from wherever you are. It's based on the same technologies for all the softwares that we're used to every day, like our email and Facebook and anything else. You can log in wherever you need to, as opposed to having an IT person to manage servers in your closet. So, something that's cloud-based is, I think, super important. That's definitely a swipe right. You do need to be a little bit careful there, because not all cloud-based is created equal. You want to make sure that it's running on a major cloud provider. So it should be a name that you recognize, like Amazon, Microsoft, Google. If it's a regional server, that could cause some issues. There's been some things in the industry that have happened where folks are using sort of not as reputable of a cloud provider, and then that ends up getting hacked, or there's some stability issues there. So you want to make sure you're going with the best of the best when it comes to the infrastructure. I think another big piece is how comprehensive the platform is. So if it has built-in features like texting, that's a swipe right as well, because you really want to try and minimize the different systems in your practice. Today, most practices already have to juggle 3, 4, 5 different softwares. And so it causes a ton of issue with respect to data. Most practice owners today are flying blind because their data is trapped in their texting software, it's trapped in their EHR software, their online scheduling software. It's all disconnected. So if you can find one that includes most of that, that's definitely a swipe right. And I think that some other pieces would just be the user-friendliness, right? So how quickly can you start learning it? And that's important because you'll need to be onboarding a lot of other folks as well. So I'll also turn the question to y'all, though, because all of you, I'm sure, have plenty of experience in different EHRs. In your experience, even going back to optometry school when you're doing rotations and probably different settings, and then now, what are some things that as you're learning a new HR, you're like, oh, yes, I love this. I'm so glad it has this, versus, what are those things that you guys appreciate in your day-to-day?
You mentioned it, but I didn't think about it until you started talking about it. Like when your EHR is connected to texting and you can like reach out to other staff or other doctors at the clinic, like if we're at a big school clinic, if that was combined, that'd be so great.
Nadia?
Yeah. I think that what you said about just being able to navigate, right? I think the reason why people like myself have all been Apple users is because everything is like cohesive and easy to use. Like you take it out of the box, you already know what to do with it, right? You don't have to like figure it out. There's no, going in and changing the HTML, this and that. We had 2 different EHRs in my practice as well, and one was cloud-based and one was server-based. So I'm not going to name names, obviously, because I don't want to talk about my exes either. But
Right. Name names.
But like one was like, I felt like the server one is like not as friendly because literally the main doctor has to go in and change the HTML all the time. Like it's crazy. Like I'll be like, this button's not working, and then he has to go in and switch that up. It's very complicated. Like as a practice owner, if I'm seeing patients all day, I just don't have the time to put towards that, right? I want to just have something that my staff can use like very easily. It's just like you take it out of the box, you turn on your iPad, it tells you what to do. That's it. That's what you want, right? I don't want to be clicking like 10 different things just to say I dilated my patient. I just want one button, that's what I want. I want something user friendly.
You have right and left, but most of the time you see the same thing in both eyes. So when you're able to just click and then it goes to the left side, and it's like really easy to just transfer over instead of having to like copy and paste, do things like that. So just like the easeability with like less clicks, I think is very important for an EHR.
The clicks is our rallying cry at Barti. That's literally our slogan, is spend more time with patients and less time clicking. Because most optometrists today, how many clicks do y'all think you spend today in a routine eye exam? How many clicks to document that in your current EHR.
40.
Really
Like-
rough guesses. Yeah.
There's like too
Yeah.
many to like record. I don't
Too
know.
many to count. I can't count
Yeah.
that high.
I was thinking
At
the same
least
though.
50 to 100.
100, yeah.
So most people, when we ask them that question, the answer is about 100. Across most systems today, even for like a routine eye exam, it's 100 clicks from start to finish to do everything, which is crazy, right? That means we're talking thousands of clicks over the course of your week. So, that's a huge piece, is actually the specific shortcuts, the thoughtfulness and the user experience actually makes a crazy big difference, because it compounds, right? Just something you're doing 15, 20 times a day. If you can shave it off, half of that, it makes a tremendous difference. So exactly, I think the number of clicks, like you said, is really the number one way that that you're going to be happy. If you feel like you're clicking all the time, that's how like, yeah, not as good. That's something that we're really excited about at Barti. We're launching, we're actually the first to launch AI transcription in our exam, which means we're basically going to be able to take it from 100 clicks down to 2 or 3 clicks, because you'll be able to record the patient encounter, and then all the notes will be automatically put into the EHR chart for you to review. And it'll filter out the irrelevant details. And, this is one of the hottest things sweeping all of healthcare technology today. And so, Barties are excited because we're bringing that to Vision, and we're going to be, bringing that capability. But ultimately, we want to get rid of all the clicks. But, that's something that ultimately comes between the doctor and the patient right now. So that's really why we started Barti. That's basically what gets me out of bed in the morning, is trying to get rid of some of those clicks. So yeah, shortcuts like marking everything as normal, or being able to copy forward from like the previous visit. Those are all really key.
Those are my favorite buttons.
2 to 3 clicks sounds crazy. Okay, so let's say now we've swiped right, and we're like gonna go on this date now with this EHR. So like, what are some red flags or deal breakers where it's like, yeah, no, I can't do this anymore?
It's a good question. And so I got a really helpful piece of dating advice in college, which was, you need to have your list of non-negotiables. And the way that you start that list is, there's a couple different ways you can do it, but essentially you pick a couple different categories. You write down like 10 things that are important to you, like maybe like physical appearance, maybe like their personality, maybe something else. You write down your top 10 in each. And then from there, you make your overall top 10 list. And then the top 3 in that top 10 list are your non-negotiables. So that's like, you absolutely need to have that. And I think, again, that's a good analogy, because very few systems have everything. There's always going to be some pros and cons and trade-offs, just like in human relationships. And really, it's just important to know, what are you not willing to sacrifice, and what are you willing to be flexible on? So in advance of even going on that first date, or meeting with an EHR company, I think it's really important to have that personal list of non-negotiables, right? Whether that's like, I need this copy forward button, or I need the equal button, or I need the texting built in, or I need it to be cloud-based. That's a non-negotiable. And then that will help do an initial kind of screen. So that's the first thing I would say, is make sure you know what you're, take even 15 or 20 minutes and just think about it, write that list down. You also want to avoid getting catfished. So what do I mean by that? So it's really important that the EHR company is willing to give you a sandbox or some kind of trial period before you make a full commitment. Because what you see in a demo is really brief. You don't always get a chance to really like kick the tires. And so, sometimes you'll see something, and then when you're in the day-to-day with live, you're like, wait, I just got catfished. So you definitely want to make sure you have a chance to like, again, either do a sandbox or do a trial period, or, some kind of period you can do an opt-out clause. Like at Barti, one thing we do different than anyone else is we let everyone basically test drive the software for 30 days. So you sign an agreement with us, we get you started. But because it only takes a couple hours to go live with Barti, we then give you essentially that first month. And if any reason you're unhappy whatsoever, you can cancel, no questions asked. And so that's really effective, because it's hard to evaluate until you actually give it a try. Just like looking at a Hinge profile, you can only know so much, right? You have to go on a date, you have to try it out, you have to get to know the person. So hard to go on a few dates with an EHR unless they're willing to let you kind of do a trial period or something like that. So I would say those are a couple things to think about to make sure that you have, a good experience. And then then from there, we can talk a little bit about the other steps, but those are kind of the main ones I would say in advance.
First date, let's say, like, how do they get to experience, like, what are some first date things that we want to experience with our EHRs?
So if y'all think about the worst first dates that you've been on, what's one of the worst first dates that y'all have been on? Let's talk about that. What
Okay,
happened?
great. I have a great one.
Yeah. Spill the beans.
Okay, so the guy invited me to dinner. He made the reservations. And then at the end of the date, just to be kind, I was like, oh, first of all, he was boring the whole time. So we hated that, right? So I brought Uno to the date and we had to play Uno the whole time because I was like, I just always bring it in case the date goes awry and they're really boring, right? So just playing Uno. And then at the end of the date, I was like, oh, it's okay. I can pay, and he's like, okay. So he let me pay the whole check.
Oh,
I was
wow.
like, well, this date is over.
There's probably an Uno test for you now, right? Where your friend's like, how was it? You're like, I got to pull out the Uno cards. You're like, oh, you failed the Uno test.
Came out. That was it.
That's a deal breaker. Yeah.
And I, went on the date and the girl was like pretty much telling me that she was just hungry and she just came for a free meal and she really just goes on dates for free meals. So I was like, am I supposed to pay for this now? Because what are you telling me? So we definitely split it, and that was it.
And that was the only date.
Yeah, that scarred me. Now I'm like, okay, the first date, I feel like we had a split, and then the second one, like I'll pay because of that. I'm not trying to just give free meals out here.
Let's do a walking date or something, just so I know you're not a gold digger.
Right.
I have a similar from a software perspective. It's funny. Barti one time did a promotion where we, you get a $50 gift card just for doing a demo, just for basically coming and meeting with us. We'll give you a $50 gift card. And so sometimes you get some bad incentives where people are literally just meeting with you, even doctors. They're literally like, yeah, well, I'm just here for the gift cards. Like, I don't actually want to. I mean, you're like, that's cool.
It's like when you go for a timeshare and you're like, I'm just here for the steak dinner
stay.
or whatever.
Yeah.
Yeah, you're like, well, I'm still going to pitch you, but this is kind of a waste of time for everybody. So, okay, so those are good. Those are really good bad first date stories. I don't know how to map those to software, but for me, for me, I think like one key thing, maybe y'all have had this happen to you, is if the other person doesn't shut up talking about themselves, right? So like one key thing I think you need on any first date is they need to ask you questions. And like, honestly, like the more questions they ask you, the better generally, because it means they're being, thoughtful. They want to learn about you. And so I think that's like the hallmark when you're meeting with a new technology partner, like an EHR company. How much are they asking about you? Because this is not picking an EHR again. It's not a transactional thing. You're not buying a T-shirt. You're not buying lunch. It's a pretty major decision. It has a lot of variables and factors that go into it. And as a result of that, you really want to make sure that you're being thoughtful and you want to make sure that the person is asking you questions, because if they aren't, that means they're not giving you a very tailored solution, and that means they might not be giving you what you need. So it's sort of like if you guys have a patient that comes in and before they say a word, or they say, hey, what are you here for? And they're like, I have blurry vision. You're like, all right, here's what we're going to do. Prescribe. Done. That's it. If you don't diagnose before you prescribe. So that's even with software, like the company should be trying to like diagnose what are your current challenges with your software, with your business, and how can we like help you meet those challenges. For example, do you have a high no-show rate that's above the industry average? Okay, then let's talk about automatic text reminders and how that can reduce, your no-show rate by half. Do you have lack of new patients? Do you have slow growth in general? Okay, well, you don't have online scheduling. You don't have a website, right? So let's talk about that, because that's an easy low-hanging fruit. But if they're not asking you questions, then they're not really going to be able to give you a good, prognosis, or diagnosis. So I would say that's like one of the biggest things is like they should be asking you a ton of questions, or you should be giving them a ton of info, because again, the reality is we need to know almost from the EHR's perspective, we need to know almost everything about your business. We need to know who your contact lens supplier is. We need to know, what kinds of appointments you offer, what kind of specialties you have, what insurance providers you use. We need to know what kinds of equipment we need to integrate with. There's a ton of different things about your business that have impact and implications. So anyways, the biggest thing on that first date is you want to know they're asking a lot of questions about you to get to know you, and not just talking about themselves and how great they are the whole time.
Yeah. Or not talking at all.
Yeah.
You gotta
Yeah,
pull out the Uno.
or like awkwardly silent and they don't have anything to tell you, and like, yeah.
Right.
You gotta hit them with the Uno. I'm telling you guys, this is foolproof. Bring it on your dates.
That's
a good way out.
I'm like struggling to say, but I'm like, if you got to pull out the Uno, that's when you almost just fake the phone call with a friend. That's like, hey, call me, pretend you're having an emergency, and I'll dip out.
The easeability of everyone being able to utilize it in the practice. Like, so now I'm talking about staff buy-in. So what are some like tips that you'd be able to share when having a new software for like smooth transition of everyone being able to buy in?
So sometimes I see people on different sides of a spectrum, but I think the first and important thing is to make sure that you at least care and show that you care about what your staff needs are and what they want. So again, just going proactively and asking them, what would you like to see? What would make your life easier? And then incorporating that into your decision. Because sometimes we do see owners who only care about like the EHR, for example. Like they only care about the exam. They only ask about the exam because that's all they care about. That's all they're in there. That's what impacts their day to day. They're not sending out the text reminders. They're not making appointments. They're not submitting claims. So they don't really care. And that's a recipe for disaster because those other things impact your business just as much ultimately on your bottom line. So I would say just doing the basics of, again, asking folks and incorporating it into your decision, not making it purely based off of what you as the doctor want. And then the other piece is trying to pick a more modern solution. I mean, I think this is one of the reasons to reevaluate every few years because there's a lot of opportunities to make your staff lives easier. Again, whether it's like automating text messages, we still talk to a lot of folks who like have a staff member who phone calls to remind every patient on the calendar. And that just takes, an hour of staff time every single day that just doesn't need to happen, and it's not even as effective as text messages. So, that's one of those reasons to look for a solution that incorporates things like texting and other areas that are going to automate and improve your staff's day-to-day experience.
In your opinion, what's the best way to introduce a new software to your team to ensure like a smooth transition? Like we're meeting the parents. What's your advice?
Totally. Yeah. You're meeting the family, you're meeting the friends, you got to get the approval. I think that, this is important because this is one of the reasons a lot of people don't want to switch is they're afraid their staff is going to mutiny. So it is an important thing to get their input. In consulting, we have this framework that's fairly common for decision making. It's called RAPID. If you guys have ever heard decision making, right? It's like this person has the decision. It's basically a way to think about in a group of people how you actually make decisions. And RAPID stands for recommend, agree, something else, input, and then decision. So perform and then decision. And the idea is that there's only one person in a group who makes the final decision. So they have the decision-making rights. They have the D. And there are other people who have input. So they're an I, or a recommendation, which is the R. But so that's the staff members in your practice. So I think it's important just to make clear to the staff members, you still have, as the owner, the decision. You need to make what's right for the business. And you shouldn't let necessarily one individual staff member preference decide the whole thing. But I think to your question, one of the best ways to get buy-in ahead of time is to ask for everyone's priorities. So again, what is each individual's non-negotiables? Because as y'all know, it takes a village, right? So who are the different roles that y'all think that probably we need to ask about for the EHR? And who are the different, and because there's different ones, right? So who are kind of the different personas or profiles that we need to think about? Because a lot of our conversations so far, and for all of y'all, you're thinking mostly from the OD perspective, right? In the exam lane, charting, because that's most of the time that you're using the EHR, right? But who are the other personas, or what are the other things that we need to think about and bring into the decision?
Like everyone who pre-tests, basically, right? People who are scheduling, definitely office manager who wants to do the day-to-day, anyone who's dealing with the insurance and the billing, that kind of thing.
Totally.
Those are my top.
There's one more. I think you basically nailed everyone. There's only one other person I might add that kind of has their own flavor of needs. You got the billing, the front office scheduling, office manager, the technician doing the pre-testing, there's one more. I would say the optician. Usually the person putting together the lab sheet, the glasses order, that has its own whole can of, the whole needs there. So I would say you nailed it though. It's like the front office who's doing the scheduling, whoever is pre-testing, like the technician, usually they're actually also in the EHR, but going back and forth. And then, the optician and then the biller, like you said, because they are dealing with the insurance. So if you think about it, it's actually like 5 very different personas. They're all doing very different things. And so that is why it's important to ask everyone what their non-negotiables are. So that, and do that ahead of time. So then you're not just going back and forth. It's going to make it a lot more efficient, because then otherwise you're going to get to be like, oh, I like this, but let me go talk to my 4 other staff members and my dog and my wife, and then I'll make a decision.
So just like in dating, we pick times when it's time to move on, time to break up. So for you, when we're talking about EHRs, what are your advice, or what's your things that you would want to point out that would cause you to lead to a breakup with an EHR?
So I think one thing where the relationship analogy breaks down, and I'll say this is you should just reevaluate at least every few years. So that goes for EHRs and software, not necessarily for relationships. But I think, again, just because technology moves so quickly, you don't see a lot of optometrists who are walking around with a Motorola Razr in their pockets or driving a 2000 Corolla. But you see an awful lot of optometrists who are rocking an EHR from the 90s. Even though that's, again, like their mission critical software. So you really should not skimp out on something that's such a core part of your business, just like you don't skimp out or use the super old technology for every other part of your day-to-day life. So I would say one thing is, if you just haven't looked, or you've been using the same thing for 20 years, it's worth a discussion at least with something new. I think some other reasons that people want to break up are, just again, so in real relationships, if somebody doesn't show up for you, right? So like downtime. This is something that people don't think about usually when they're shopping for an EHR, but when your software just goes down for 3 hours in the middle of the day, and has all of your patient data, has all your charting information. I don't know, let me ask, has that ever happened to y'all, with either a cloud-based or a server-based one? Yeah. What has that experience been like?
It's paper charts, which is the worst.
Yeah, exactly.
Yeah,
and then you're retyping that in later, right? It's double entry, and then the front office is pulling their hair out, and it makes you look bad to the patient. So that happens more than you think, even with like cloud-based solutions. And so that can be catastrophic for the business. Sometimes it's happened for weeks at a time. Again, sometimes if things get hacked, or systems can be down for days, weeks or months at a time, and that's when you're like, all right, I'm ready to break up. If we were gonna have dinner with my parents 3 weekends in a row, and you like didn't show up 3 times in a row, that's gonna be an issue. I think that another thing is if the support, if you need questions answered, or you need upgrades and they're just not being responsive, and if you've asked a bunch of times, you can't get a hold of anybody, that's just frustrating for anyone, and especially, again, because it's such a critical software. I think that's not one you want to mess with, is bad service. And then something that frustrates folks is if you get a big price increase without any changes to the product. So that's another reason to reevaluate as well, which we see that where people are just raising prices, but it's like, hey, have you shipped a new feature in the last 3 or 5 years? No. Okay. Am I getting better service? No. Okay. So why am I suddenly paying way more in cost? So I think those are some reasons that you might want to either have the talk, we need to talk, or really seriously think about breaking up and evaluating someone new.
Okay, let's talk about double dating, like integrating the software into other things, other technologies that you currently might have in the office.
Yeah. Whatever EHR you have, it needs to play nice, because it's really the foundation, again, for everything else. Basically, everything else needs to plug into your system. And this is one of the classic kind of afterthoughts, where a lot of times doctors or practice owners even are like, oh, well, actually it needs to integrate with this. Oh yeah, it also plugs into this. And it's kind of sneaky how interconnected your EHR is with every other aspect. So the short answer is, again, this is an area where it's better to be proactive and just take 10 minutes and write a list down of every other system that you're using currently. If you're a new practice, some things to think about. Here's some of your the things that you need to consider. The clearinghouse, meaning how you submit insurance claims. which is how you get paid. So a lot of EHRs should have an integration with a clearinghouse, which basically means you can just click a button at the end of the day and transmit those claims directly through EHR. So that's an important piece. Optical ordering. So again, if you're selling glasses and you send it to a lab, you can have an integration with something like VisionWeb or Spec Check that lets you, again, easily transmit those lab orders without going to a whole other system, a whole other website. Payment processing. So again, seems like something small, but like at the end, when the patient swipes their credit card to pay for their glasses, some EHRs have that built in, which is nice because it saves that step. Otherwise, you basically need to swipe on a terminal and then your staff needs to go back and re-enter into your EHR that you collected that money. So again, it's all about saving your staff time. It's all about automating things so that you and your staff can focus on what you do best, which are not these like tedious manual things or double data entry. And then we've talked about this a lot, but texting, this has become a little bit more common now that it's built in. Most people today have a whole other platform or a whole nother software solution that they use just for texting. And then hopefully that integrates. If not, then again, you're really living in very different silos where a patient will text you and you don't see it, or the patient texts you, but then you have to go search and pull up everything about that patient in a different platform. So having, built in or a good integration with the texting platform, that's helpful. And again, the list here goes on. I could go on and on because there's so many others. But for example, if you sell contact lenses, soft contact lenses, more and more soft contact lens distributors or manufacturers will give you huge rebates if you integrate with a data analytics provider and basically give them data on what you're selling, if that makes sense. So like if you integrate with Edge Pro, if your EHR integrates with Edge Pro, for example, and they see that you're mostly selling Johnson & Johnson contacts, they'll give you an extra $30,000 in a quarter in rebates. So it's like it's like really meaningful for some practices. But if you can't integrate with Edge Pro, which is basically an analytics platform, and it's the only one Johnson & Johnson uses, if your EHR doesn't integrate with them, you're just kind of SOL. And so again, that's where it's a little bit specific to the practice, and you need to be a little proactive to think about what is important for me for those integrations. And then the final piece I'll say is hardware, right? And this is where a lot of automation comes in the exam lane, is your auto refractor integrated with your EHR, or you like printing out a sheet of paper and hand copying it every single time. Same thing with the lensometer and other things like that. So yeah, lots of other systems to consider and lots of integration points. So
I'm that doc that's, been in that relationship for 30 years. And it's time to renew the vows. So in terms of EHR, do I stick with my vows with my current EHR or reaffirm and do something new?
Yeah, absolutely. So I think there's a couple things to consider when you're thinking about renewing your vows, or, and I think genuinely this is actually something I think a lot about with my relationship advice, is how you grow with your partner, right? And so it's not just how two people are at one fixed point in time, but you're going to be together for a long time, right? And so you're going to be growing together alongside each other. So how do you grow together? First of all, are you both growing, or is one person stagnant? Because that's an issue, right? And then do you grow sort of complementarily, where you can kind of weave together and still do your own thing? Or is one person maybe like getting jealous, or is maybe one person, not, or are you totally growing apart is the other option, right? You maybe sometimes just go in totally different directions. So I think same thing with like an EHR, meaning is your practice growing? Are you growing as your business? Are you adding locations? Are you adding staff? Do you want to improve your patient experience? Well, how easy does your software make all of that? Meaning how easy do they make it to expand and add a location? Can they even support multiple locations? How easy do they make it to add a staff member? Do they charge you for every single staff member? That doesn't really seem to make sense or be fair, right? Do they charge you per location or per doctor, for example? Those are things to consider. And then are they growing, right? Are they growing alongside you, or are they sort of stagnating their business, right? And you're like, no, I'm a dynamic business. I want to be growing. So I would say though, if you look at those things and you say, yes, I want to continue to renew, I always encourage folks to be business minded. And so there's a couple simple frameworks, right? I mean, cost benefit and like ROI is a very, very simple one that we try to use, is just, if you continue paying your EHR X thousands of dollars per year, what are you going to get out of that? What's the ROI? For example, with Barti, the way we communicate our ROI is we help practices see an extra 1 to 2 patients per day through saving the doctor time, as well as getting more patients through the door through texting and online scheduling. What that translates to is a 10x return on what you pay Barti for the software, because you're getting an extra, 20 to 30 patients a month, which boosts your top line revenue by thousands of dollars per month. And you're paying Barti a fraction of that. So that's one way to think about the ROI is, what am I paying? What am I getting? And, there's obviously a million different ways to skin that cat of how you think about the value, but you should be able to conceptualize, okay, this is going to save me time, or this is going to make me money. It should do one of those two or both of those things, right? It's either going to save my staff time, which saves me money. It's going to save me time, which saves me money. It's going to cut my monthly recurring costs of subscription spend, or it's going to make me more money, right? I'm going to get more patients in the door. It's going to reduce my no-show rate. I'm going to get more new patients. I'm going to be able to charge more because I have a more premium service, that kind of thing. So that's always a couple basic frameworks that I encourage owners to think about when making really any kind of purchase.
So as we're wrapping up, I think we've hit some great topics. We've talked about swiping left and right, the red flags we should be aware of, the good that we liked when dating our EHRs. We've talked about the first date. We've talked about meeting the parents or introducing it to the staff, when we should break up, when we should renew our vows. There's such good information here, so I hope you guys are all enjoying this conversation. Colton, do you want to give us your last dating advice as we're wrapping up? Any last words that you want to tell us about Barti or the EHR? And then where can we find Barti if we want to start dating EHRs?
Yeah, absolutely. So last piece of advice is put yourself out there. So, you have to at least go on dates and try to meet new people. And same thing with evaluating technology. So if you're just sitting on the sidelines, you're never going to find a partner that you really like. So you should go out and look and be open-minded, try going on some dates and talking to some folks. So, and I encourage people to do that, go on multiple dates. So then you feel more confident in who you actually end up with, right? It's sort of like not necessarily the best idea if you ever go on one date in your life and that's the person you end up with. So keep an open mind, and no shade to high school sweethearts, but keep an open mind and put yourself out there. Barti makes it really easy to take a look. So check us out at barti.com. We'd love to show folks our newest AI capabilities, as well as how we unify everything together in a system that's 10 times easier to use. So especially if you're a new practice owner, I think it's a no-brainer to take a look. So I would love to talk more about it in a different time.
Barti.
Come party with Barti.
I have a question real quick. Where did the name come from?
Great question. So you'd be amazed how few people ask that question. We get that question like 1 or 2% of the time. So our whole focus is helping eye doctors to treat eye disease. And so it's a mythological, biblical reference. So in the Bible, there's a lot of blind people who are cured of their blindness. There's only one of those people who has a name, and that person's name is Bartimaeus. So Barti comes from Bartimaeus. Yeah, very, very
you
kind
should
of
have led
obscure.
with that. That was crazy.
That's amazing. I should have asked that first.
The idea is, we're trying to help cure eye disease, and it's also two syllables, easy to remember.
Yeah.
Yeah, that's definitely going to be our first clip. So we got you.
What are the upcoming conferences you're going to?
Yeah, absolutely. So we will be at COVD actually in just next week in San Francisco, just down the street from our headquarters. And then the biggest next one would be optometry's meeting in Nashville. We are running a great program in CE for para-optometric staff, and we'll have a great booth as well. So come by and get some cool Barti Barbie pink sunglasses. And then after that, I think the next biggest one will be Vision Expo West. So yeah, always come by. We have some great swag, iPad raffles, and you can also see a demo.
Awesome.
Yeah.
Yeah, we'll definitely see you at one of those. Yeah.
Yeah, I need that for my bachelorette party. I'm on my way.
Yeah.
Barbie pink sunglasses.
Great conversation, and it was really fun with how we integrated it with swiping left or right.
Yeah. Likewise. Thanks so much for having me, y'all. And Take care.
Hey everyone, I hope you enjoyed the episode.
Don't forget, if you want to try Barti at your practice, you can get a 20% discount on the first year contract. So be sure to look into that.
Click the link in the show notes to set up your appointment with Barti and learn more. Thanks for listening. Hey guys, thanks for listening to the Depth Perception Podcast. Don't forget to like and subscribe on all of our platforms, including
Spotify,
Instagram,
Google Podcasts,
Apple Podcast.
YouTube. Make sure you click that button. Double tap that.
So you guys have no reason not to follow us and tune in to the next episode.
Stop wasting time.
Get in depth.
Subscribe.